Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Hi, I am your Dr. Minal Chandra. I am the co-founder and chief consultant at Epione Pain Management Center. And today I'll be talking about headaches. So the first thing is, all headaches are not migraine. Migraine is one type of headache, but we have multiple classification of headache. Depending upon how your headache starts, where is it, how it radiates, what are the other symptoms associated with it, that's how we define headache. Now, most commonly, we all know what is migraine. So, migraine is something where you have pain usually on one side and sometimes on the other side, and sometimes it may alternate. And you may have a problem with the light, you may have problem with the sound, and then before headache sets in, you may get a lot of vomiting sensations, giddiness. These are called as aura. Now, we also have a migraine without aura, where you may not have all these symptoms, like difficulty with light and sound, and nausea sensation may not be there. Now, usually in migraine, what happens is there are multiple factors that will play a role. So, you need to identify what is your triggering factor. For some patients, a specific type of food may trigger. For some patient, hunger may trigger. For some patients, sunlight may trigger. For some patients, stress may trigger. So, the most important thing is the preventive measure. So, first thing is identify your triggering factor and try to avoid it. Once you have identified your triggering factor and you have started avoiding it, you may get little relief. The number of episodes may decrease, the intensity of pain may decrease. Now, I would like to tell you that migraine does not have a proper treatment where you take a treatment and migraine will stop. No, that is wrong. We can manage migraine. So there are lots of ways where we can manage migraine, but migraine usually over a period of years, it may slowly resolve, and when you attain your 50, 55 like that, it may slowly wean off. So this is a realistic goal. First, you need to understand that migraine cannot be treated completely, it can be managed. Now, once you have understood that, second point is identify your triggering factor, make lifestyle modification, and you need to plan your day in a way that all the triggering factors have been avoided. You are in a comfortable place, and you are not as much stressed related to your work at home or in the office. Make sure that you are having all your meals at time. And still you realize that your pain intensity keeps on increasing, or the number of episodes in a week keeps on increasing. Then you need to take a proper treatment. Proper treatment may, first you need to do a MRI scan or a CT scan of the brain to rule out that there is no other causes of any structural damage in the brain. Now, once that has been ruled out, your treating physician will make a diagnosis of migraine. And then there are proper way of treating migraine. The first thing is the preventive medicines. So these are preventive medicines that will prevent you from getting the migraine attack. So there are few tablets which your prescribing doctor will tell you which you need to take in spite of not having any migraine attacks. Second is when you get an attack. So now when your migraine has set in, what to do? Again, there is a set of tablets. There are some nasal sprays which your doctor will tell you. And the third thing is, if the attack is more than 15 in a month, you should opt for Botox. So Botox is something that is going to give you good relief over a period of 6 months or maybe 8 months or up to 12 months. And the most of all is to maintain a pain diary. Maintain a pain diary where you need to write everything about the type of attack, for how much time it was there, how it went off, so that you have a record how these tablets are helping you out, and so that when next time you visit your doctor, you can show the pain diary, and then we can adjust your tablets and other things. So make sure that you maintain a pain diary, which is very, very important for migraine.